class is a health promotion class, promoting health in the public. A huge part of nursing is teaching and educating our patients and their families. Health planning is a dynamic process where the nurse and client together should assess the behaviors that they want to change. The ultimate goal of health promotion and planning is to make health promotion and prevention a way of life for the client and their families. For our project, we chose to focus on substance abuse in adolescents aged 12 to 18 in Suffolk County. We felt this was important because underage drinking and drug use is a huge problem in our area, and teens need to be better educated on the effects of substance abuse and the tools necessary to prevent substance abuse. So, basically, can you guys see this? Is it big enough? Okay. So basically, our target population was adolescents 12 to 18. The goal in that age group is to improve healthy development, health, safety, and well-being. Reducing substance abuse can help protect health, safety, and quality of life for everyone. Young adults aged 10 to 24 make up 21% of the population in the United States. Higher stress in early adolescence is associated with a range of risk-taking behaviors like smoking, drinking, drug use. And youth drug use continues to rise, with 1 in 4 suffering from addiction. And those under 15 are 5 times more likely to be dependent later in life. Okay, so this was the overview of our needs assessment. Basically, we created a tool that I'll show you guys that would be part of our project, and it would be handed out in schools, and it would be an anonymous screening where they would answer questions based on their drinking and drug use, just to kind of get an idea of how much of it is going on in the community. Yes, you drug abuse is at an all-time high with teens. Age 11 is the average age of onset in Suffolk County, shockingly. Teens who drink before 15 are more likely to be dependent later in life, and those who use drugs are 5 times more likely to drop out of high school. In New York alone, in 2007, it cost the taxpayers $3.5 billion for underage drinking, with accidents and arrests. So the most important thing working with this population is to create a trusting relationship and a respectful relationship so that they'll be open and honest with you. And you have to make them feel comfortable so that they will be honest. So basically our project, our main goal was to increase awareness and provide preventative education on the effects of drug and alcohol abuse in teens. We had 3 objectives. The first one was by September 2014, 90% of teens 12 to 18 in Suffolk County would be enrolled in a drug and alcohol prevention and education course during school. The second objective would be that during the school year, 85% of students would take part in that survey that I handed out to you to evaluate the substance abuse in Suffolk County. And the third objective is that by the end of the year, 100 families in Suffolk County would be enrolled in a program where not only the teens, but also parents and other siblings would be involved in the process to help learn how to communicate and talk about peer pressure, anything like that, where teens could feel more comfortable talking about their issues. So with the first objective, which was getting enrolled in the course, we had a couple different interventions to help make that successful. The first intervention was making it a mandatory course to address all forms of drug use. Students would need to be actively involved, and the classes would be weekly for an hour or so. The second intervention would be improving academic and social emotional learning. Basically teaching skills like self-control, emotional awareness, communication, dealing with peer pressure, And then the third intervention would be to empower teens by incorporating their input and community service into the program. They would be encouraged to attend like AA meetings or NA meetings to see, you know, how using or drinking could affect them later on in life, because I think that really makes it real for a lot of people. All right, so objective 2, which was taking part in the screening tool, an intervention that we had for that would be obviously to give out the screening tool during the school year to assess the prevalence of substance abuse. After evaluating the scores, students would be offered referral for treatment or counseling, whatever they would need. Results would be anonymous and confidential to assure that they would be honest when they're answering the questions. Schools could also set up group or private sessions where they can feel comfortable talking about issues that they have going on. And another intervention, all the data would be collected and evaluated to look at the statistics of the actual use on Long Island and try to target that. And then our third intervention was enrolling the families in a program. The first intervention, family-based prevention programs that would enhance family bonding and increase parenting skills. Parents will learn to develop, discuss, and enforce policies, and also receive information and education about different substance abuse, what's going on in high schools, because it's pretty crazy. The second intervention, supervision, would be critical for drug abuse prevention, so parents will learn rules like rule setting, monitoring activities, praising good behavior, and disciplining, obviously, bad behavior. And a third intervention, parents and teens will learn skills to effectively communicate with each other. And teens will be given the opportunity to talk about their feelings or concerns with their parents in a setting where there's kind of a third party. The classes would consist of like different scenarios and stuff like that.
Susannah, you shouldn't here.
Sorry. This next part is just cultural considerations. We know being nurses, we deal with a lot of different cultures, a lot of different people, so we always have to be understanding to different people's needs. Being able to communicate with people based on their religion, their race, their gender, what they believe in, we really need to be respectful of that. And even in this circumstance, teens are very hard to deal with. So it's important to understand where they're coming from and try to be open and honest with them. Culture can determine how someone reacts to pain, copes with stress, deals with different life circumstances. So it's important for us to definitely be mindful of that. These are just some recommendations for healthcare workers working with teens. When working with them, nurses should consider their education level, their culture, their family dynamic, to make an effective plan in dealing with them, to make it a positive experience. One recommendation would be to develop a trusting and safe relationship. Showing respect for a teen is vital to create an open avenue for communication. A second recommendation would be to redirect federal funding for substance abuse prevention programs to be more productive. The third one we used was using facts, not scare tactics, to educate teens. Just using cold hard facts, not trying to, kill you. So in order to be effective, it should be factual and rational. And then the fourth recommendation would be to incorporate family planning into program objectives. Family structure and dynamics is important when working with teens. Depending on their individual situation at home, you might have to approach it differently with each individual person. And this was just an evaluation of our outcomes, looking at the whole process, collecting and analyzing the information to actually understand that it is a real problem in our area. These are just some questions to evaluate if the health promotion plan was effective. How does it work? What are the intended outcomes? Our plan objectives were based on the ability to involve teens aged 12 to 18 in Suffolk County to participate in the substance abuse prevention program. And these are just some. This was just evaluating our outcomes, that at the end of the year, 90% of the students would be in the program. The second objective, that 85% would do the screening tool, and that 100 families would be enrolled in the program by the end of the school year. And that's about it. So I hope you enjoyed it. I really appreciate you guys. Thank you.